Well, we've seen them pop up all over Central Texas. You might have even been to one, these urgent care centers or freestanding ERs. And you've got a lot to choose from when you don't want to go to a full-on hospital or doctor's office. Do they have their differences, though? This morning, local pediatrician Dr. Ari Brown is here to help us weed through all of the confusion. Thank you so much for being here.
Sure, thanks.
So first off, tell us, why are we seeing so many pop up?
Well, demand makes the marketplace change, and so people want convenience. They don't want to wait until the next day. They don't want to miss work. They don't want their child to miss school, and so people are seeking alternatives, and so that's why the marketplace is changing.
Are they all created equal?
No, and that's important for families to know, especially if we're talking about a child. And so there's one structure, which is like a pediatric after-hours care, which is what we offer, which is a pediatrician or a pediatric trained provider that can see a child in the office, provide lab, maybe provide x-ray depending on the office setting, and do minor illness and injury. Then there are kind of convenience care clinics, which are usually staffed by practitioners who are family practice practitioners, so they may not even see a child under the age of 2. Then you've got urgent care centers who definitely offer lab work and x-ray. The cost goes up as you go to these different levels, and then you've actually got freestanding ERs or the emergency room in a hospital.
I do have to say it's inviting, though. I went to my first one a couple of months ago. My husband cut his leg, needed stitches, literally dropped him off. I was starving, went and grabbed a burger, came back, and he was done, ready to go. I mean, we were back home in less than an hour.
Yeah, I mean, it's a great alternative, because if you went to a hospital ER, you'd be sitting there half the night, and your bill would be even more expensive. But when you go to an urgent care center or a freestanding ER, know that there is a price tag associated with. So be an informed consumer and ask up front, how much is this going to cost me? Because they do charge differently depending on the level of service they are able to offer. Not necessarily what you're getting, but what they're able to offer gives them a different price tag when it comes to insurance claims.
And like you said, you've extended your own office hours. Are other doctors doing this as well?
Well, unfortunately in pediatrics, less than 1/3 of pediatric offices offer after-hours care, and kids need care after hours, and so it's nice to be able to meet that demand, and so I would love for every pediatrician to offer that, but it's just not happening right now, and so we do offer that care for other families who want to see a pediatrician or pediatric trained specialist, and continuity of care is super important. So whether you go to an office like mine or you go to any other type of urgent care center, be sure to follow up with your doctor, because fractured care is not good care. You need to have a medical home and use it.
What has the response been like when you extended your hours? Are you seeing the people pour in?
Well, we're just getting started. We only opened last week, but yes, we are seeing, I was there working all day yesterday, and so yes, we are seeing people who are very thankful that they have an alternative. It doesn't cost extra money to go because it's considered a doctor's office, and so it has a different level of care. And as I said, we definitely want to communicate with providers, so if you are seeing in a facility like mine, we definitely connect with the providers so that there's follow-up care.
Absolutely. Dr. Brown, thank you so much, and very good information to help us weed through all of the choices out there.